is. So that's our role here today. Let me give you a quick rundown of how this is going to work, and then I'll turn it over to our speakers who are here today with this important announcement. So quickly, there are two ways that as members of the media you can ask questions. The first is if you'd like to put your questions in the Q&A, not the chat, but in the Q&A, I'm happy to read them to our panelists and have the most appropriate person answer them. If you prefer to ask your question live, please raise your hand, virtually raise your hand, and we will allow you to speak when we get to that point. So let me quickly introduce to you our distinguished panel who are here today to help us with this important announcement. Dr. Chris Farnetano is the Health Officer for Contra Costa County. Dr. Tomas Aragon is the Health Officer for the City and County of San Francisco. Dr. Sarah Cody is Health Officer for Santa Clara County. Dr. Nicholas Moss, Health Officer for Alameda County. Dr. Matthew Willis is Health Officer for Marin County, and Dr. Lisa Hernandez is Health Officer for the City of Berkeley. Each one of our panelists today are going to give brief introductory remarks, and then we will do the Q&A after that. So, Dr. Farnetano, I'm going to let you take it from here.
Thank you for joining us today. Again, I'm Dr. Chris Farnetano, the Health Officer for Contra Costa County. We are entering an especially dangerous period of the COVID-19 epidemic. As we heard yesterday from the governor, our state is experiencing an unprecedented wave of COVID-19 transmission, and Contra Costa County and other Bay Area counties are no exception. In just a single month, the number of new COVID-19 cases identified every day here in Contra Costa has more than doubled and is higher than even our highest numbers during the summer peak. The number of patients sick enough to need hospitalization has tripled and is higher than even our highest numbers during the summer peak and is still climbing. Based on our early data, we believe December will be worse. The dark COVID winter that we feared would come has arrived in the Bay Area. I and other county health officers in the Bay Area don't think we can wait for the state's new restrictions to go into effect later this month. We must act swiftly to save as many lives as we can. This is an emergency. That is why we are making temporary changes now to slow the virus and protect our community, particularly those at greatest risk of serious illness or death because of COVID-19. Today, the City of Berkeley and 5 Bay Area counties, Alameda, Contra Costa, Marin, San Francisco, and Santa Clara, will issue new local health orders designed to reduce the spread of COVID-19. These health orders will become effective Sunday, December 6th, and will stay into effect until January 4th. The orders will require many local businesses that operate indoors to further reduce occupancy to 20% and to write and enforce plans to ensure occupancy and face covering rules are followed. Personal care services such as haircutting and nail care must close. Restaurants must close outdoor operations and convert to a takeout and delivery only model. Outdoor wineries and card rooms must close. These changes limit situations where people from different households may come in contact with each other, particularly indoors. The goal of this temporary order is to reduce the risk to everyone during a time when COVID-19 is spreading rapidly in our communities, and to ensure our healthcare system can continue to provide every patient with an appropriate level of care. As much as possible, this order resembles the statewide regional stay-at-home order announced yesterday by Governor Newsom. The key difference is that the state's order does not take effect until ICU beds in the Bay Area are 85% full. Governor Newsom said yesterday, the bottom line is, if we don't act now, our hospital system will be overwhelmed. If we don't act now, we'll continue to see our death rate climb, more lives lost. We agree with the governor. We believe that our best chance to save lives and to protect the public's health is by acting now. I'm going to pass things off now to my close colleague, Dr. Tomas Aragon, San Francisco's health officer, to talk about the current surge status.
Good afternoon. I'm Dr. Tomas Aragon, health officer for the City and County of San Francisco. The Bay Area is a model for how we work decisively and collaboratively to slow the spread of this virus in our communities. Back in March, we worked together to implement a regional stay-at-home order that saved lives and improved our hospital capacity. Like the rest of the country and the state, the Bay Area is facing a rapid and widespread increase of COVID-19 cases and hospitalizations. The data shows that early action is once again needed. In the Bay Area, COVID-19 cases have quadrupled during the last month. On October 22nd, the Bay Area had an average of 475 new cases per day. Now, every day, over 1,700 new people in our region test positive for COVID-19. For every positive person that's infected, we know that that person is infecting at least 1.5 other persons. The virus is moving quickly, and we need to bend this curve now, as we have collectively done before. One thing to realize is that for every case that we do detect, there are 6 to 10 cases that go undetected. The coronavirus cases are growing exponentially. Transmission is widespread. This virus is relentless and unforgiving. We have no choice if we want to be able to take care of our communities and our loved ones in our hospitals. Between November 27th and the present, we have experienced an increase of 190 COVID hospitalizations in the Bay Area. At this time, there are over 1,000 COVID positive hospitalizations in the Bay Area. Within weeks, we will be unable to care for our residents at our hospitals. Unlike previous surges, every hospital in California is under stress. There is no place to transfer people if we run out of beds. 3/4 of the state's hospital beds are currently full. Nearly 25% of them are filled with COVID-19 patients. This rapid and widespread surge also has a significant impact on our ICU capacity. I'd like to introduce Santa Clara County Health Officer Dr. Sarah Cody to discuss the regional ICU impacts.
Thank you, Dr. Aragon, and good afternoon. Again, my name is Dr. Sarah Cody. I'm the health officer here in Santa Clara County. And as we've all said many times before, each of our jurisdictions, we are not islands, and acting together enables us to better and more completely protect the public and everyone that we collectively serve. And similar to March, the surge in COVID-19 patients needing hospitalizations has struck Santa Clara County first, but we know that our region and surrounding jurisdictions are soon to follow, and indeed are already experiencing the surge that we are experiencing more acutely, as described already by my colleagues. So I wanted to share with you what we're seeing here in our county as far as ICU beds, because I think it's a story that others are seeing and will continue to see more acutely. So as you know, we need the capacity in our hospitals to care for all patients, including those patients who are critically ill and require intensive care, whether they have COVID or another illness. And so those beds must be available, and they must be staffed and ready to care for patients. So here in Santa Clara County, the average percent of ICU beds filled with COVID-19 patients has tripled in the last month and continues to accelerate. Yesterday, we had a record-breaking 67 new COVID patients admitted to hospitals across our county. So that's an all-time record, and unfortunately, we are shattering records every day. As of today, we have less than the 15% ICU capacity, the metric set by Governor Newsom. We have, in fact, only 14% of our non-surge ICU bed capacity remaining in our county. Many of our hospitals have already elected to cancel elective surgeries and other procedures in order to be able to care for the influx of COVID patients. So Our county already meets the state's metric, and our ICU capacity continues to decline. And all of us, all of the counties around us, are beginning to see this as well. But what I really want to emphasize, and I think that my colleagues have addressed this as well, is what we know, what we have learned from our previous experience. And that is that it takes at least 3 weeks for our actions to impact the trend in hospitalizations. At least 3 weeks. It's a very long lead time. So we must apply the brakes at least 3 weeks prior, or we will run out of the needed ICU and hospital capacity to care for everyone who needs care. And in our county, we're already a little bit behind. And that is why it is so critical that we have this regional action. We know that a lot of COVID transmission occurred over the Thanksgiving weekend. And while we can't see that yet reflected in our numbers, we do have some early warning metrics that are telling us that that transmission did occur, and that will further impact the surge in our county. So what all of this means is that we feel that, in fact, we have little choice but to act, and to act now, and to act as a region. We understand that these restrictions will create very difficult economic challenges, and we aim to lift these restrictions as soon as we possibly can. But we hope that by acting early and by acting as a region, we will have the best chance of bending the curve faster and of getting out of this difficult situation sooner and of saving more lives. And now I'd like to pass the virtual mic to my colleague, Nicholas Moss from Alameda County.
Thank you, Dr. Cody, and good afternoon. I'm Nicholas Moss, Health Officer for Alameda County. Rising hospitalization rates across the Bay Area threaten not only our community members with severe COVID-19, but anyone who may need care because of a heart attack, stroke, accident, or other critical health need. By acting together now, we will have the greatest impact on COVID-19 surge, and we will save lives. We've learned a lot over the past year, and one of the most important lessons has been that acting early pays off. We cannot turn the curve on a dime. It takes weeks for new policies to prevent new hospitalizations. If we wait to see the worst that COVID can do, we'll be acting too late. Another important lesson we have learned is that the more we are able to act together, the greater an impact we can have. When cases are rising across the region, it is only a matter of time before things get worse for each of us. Alameda County is not an island, as Dr. Cody said. None of us are. Our communities and health systems are intertwined, and our epidemics are connected. When our neighbors run out of hospital beds, patients will need to come to our hospitals. And this is not limited to just the Bay Area. This means we have fewer beds than we think because we will be asked to help, and we will help by providing beds when our neighbors run out. The earlier we act, and the more quickly we act together with our neighbors, the greater the impact we can have in saving lives and ending this surge more quickly. We also ask residents not to delay any needed medical care. We're in this together. Let's do our part. Stay home, stay healthy, and we will be together soon. I now turn things over to my colleague, Dr. Lisa Hernandez, to speak to actions the public can take.
Good afternoon, and thank you, Dr. Moss. I am Dr. Lisa Hernandez, Health Officer for the City of Berkeley. COVID-19 threatens hospital capacity throughout the region, and the virus is spreading in our community with unprecedented speed. We must take immediate, decisive, collective action. Each of us can fight the multiplying spread. Stay home as much as possible, choose low-risk activities when you do go out, and limit how many times you do. The virus spreads easily between people. Face coverings and physical distancing remains crucial, but we have reached a point where more drastic action is needed. Until we get through this wave, you should not meet in person with anyone you do not live with, even in a small group and even outdoors with precautions. If you have a social bubble, it is now popped. Wash hands regularly. Absolutely stay home when sick. Telecommute to protect those who cannot. Do not let this be the last holiday with your family. Show your family how much you care. Let them know that you'll choose safer options. The holidays are coming, and we need everyone to avoid travel. Mixing with other households is dangerous. Mixing with others in tight spaces required of planes, trains, and buses for extended periods of time is even more dangerous. We strongly recommend that anyone who travels out of the region or who gathers with a traveler from outside the region to quarantine for 14 days. Winter holidays are a time many of us cherish. Celebrating with our own household is the safest way to celebrate. Connect virtually to include others outside of your house. I will now like to introduce Dr. Matthew Willis, Health Officer for Marin County, and he will speak about the support to businesses and the economic health of our community.
Thank you, Dr. Hernandez. I'm Matt Willis, Public Health Officer for Marin County. We recognize that public health is about community well-being, and that includes the economic health of our community. As we take this step, we want to remind people to support their local businesses as much as possible. Doing it from home, utilizing online or curbside pickup at local stores and restaurants. This is a hard way to close what's been a really hard year. We're just beginning to receive the first doses of vaccine, and so there's light on the horizon. Unfortunately, we're seeing surges in cases, and we need to hold the line at least through the end of the year. One of the things we've learned about this virus is that it takes advantage of inequities, and many of our residents don't have the freedoms to avoid risk of exposure, especially our essential workers and those who have been on the front lines from the start. Most of us do have freedom to choose. And with that comes responsibility to limit our risk so that we're protecting our most precious resources, our community, our healthcare system, and one another. Now I'd like to hand things back to Kim McCarl, Public Health Information Officer for Contra Costa County, for questions and answers.
So thank you all. I would agree with you, Dr. Willis. This is a tough message to deliver, especially at this time of year. So we thank you all for being here today. I have just a quick reminder for those of you in the attendee list. You're welcome to submit your questions either via the Q&A function, or if you prefer, raise your hand and we'll unmute you so you can ask your questions directly of the health officer. So I have one in the Q&A section that I'll read, and then we'll go to the live questions. Angelina Wong with KTSF, her question is, since the Bay Area is considered as a region, is there any coordination between the counties in terms of taking care of COVID ICU patients? For example, if Santa Clara County has reached the capacity of 85%, will patients be diverted to hospitals in other counties?
I can answer that. We do have a mutual aid system that works not only across the Bay Area, but across the entire state. And so if one county is out of hospital beds or ICU beds, then there is a call put out to other neighboring counties and then even beyond. During the summer surge, we served that function. And when Southern California was under a tremendous surge, many Bay Area hospitals took in patients from other counties and even beyond the region, and we're prepared to do the same for this surge.
So it looks like we have a question from Ethan Barron. Ethan, can you tell us what media outlet you're with and ask your question? Do we have him unmuted?
Ethan Barron from the Mercury News. And I'm wondering first why San Mateo County isn't involved with this this plan, and also Maybe Dr. Cody could answer the question. And I'd be interested in actually hearing from anyone who is able to answer this one. Is there anything the hospitals are doing or can do to boost their ICU capacity? And what's standing in the way of that or making it difficult? Like staffing, is that an issue? Lack of beds? But first, San Mateo, and then the ICU question, please.
Thank you for the question. I can start. With regards to San Mateo, I think that's a question best asked of San Mateo. All of us work as much as we can as a region, but of course we are all separate jurisdictions. With regards to ICU capacity, it's around the ICU beds that are currently staffed, so this isn't counting surge. So many hospitals do have surge plans, but the important thing to remember, this surge is a bit different than our previous surges in that we are experiencing the surge as everyone else is experiencing the surge too. And the critical resource is staffing, in particular, staff that are trained in a critical care setting. So that is one of the many reasons why prevention is the best solution. And to the extent that we can prevent our residents from needing care, that's the way we can best protect the hospitals from the surge. Hospitals do collaborate with each other and do what's called load balancing as a system to the extent possible. But particularly with critical care patients, there are added challenges in moving patients who are critically ill. And if any of my colleagues wish to add, I invite them.
I can add. I had a conversation with one of our hospitals this morning, and they reported that 5 of their staff members were out with COVID-19 themselves. And that's another aspect of this, is that if we're able to reduce community-wide transmission, that actually reduces the risk that our healthcare workers themselves become infected. And that's been one of the real strains on our hospital-wide staffing capacity, has been actually the risk of infection of healthcare workers themselves.
Another question in the Q&A section comes from Tayana Garcia with Univision 14. The Latin community continues to be the most affected by this surge, given many factors, some of them being large family gatherings. Now that the holidays are here, what is the recommendation from public health officials, and what alternatives and options should they keep in mind? Who'd like to start on that one? I'm certain you all have recommendations.
I'll go ahead and start.
Great.
And this has been a real difficult issue for really across the whole United States. The Latino community has been impacted more than anybody else. We know in San Francisco over 50% of our cases are Latinos, and just because the number of people that are becoming infected, we also have a disproportionate number of deaths as well. And I know especially at this time of year, it's very difficult when people really feel the need to meet with family. Many of them are essential workers. They have to get on public transportation. There's many opportunities where one can become infected. And once you bring an infection into the house, it's very difficult to prevent people becoming infected. It's very difficult. And the people in the house are essential workers. They go to work and it continues to spread. I can tell you what I did with my family, which was very difficult. Basically, we all came and did a drop-off. We did a food exchange. We all came and we made food for everybody. We came, we exchanged foods, and then we outdoors, of course, and physically distanced and with face coverings, and then we went home. So it was just basically it was a drop-off. And we spent a lot of time, calling each other. I think it can be done. This is so important at this time of year. As one of our health officers says, it's really critical. We do not want this to be the last holiday celebration with a family member because someone became infected and died. And we're almost, the vaccine is around the corner, and we're reminding people that this is, please, be careful. Stay with your household this holiday season.
That was a great story. Thank you, Aragon. Anybody else want to add to that?
I'll just say that for Thanksgiving, we did a Zoom get together with my brothers and sisters and my father, rather than risk bringing us together in one place. And so that's another option.
A question from Raquel Maria Dillon with KQED. Would you please explain the thinking behind shutting down playgrounds again? Anybody?
I can start. I think what I want to emphasize is that what we are doing as a Bay Area region is trying to align with the state framework and the state order. The only change that we're making is the timing. So because we feel as a region that the trigger wasn't fast enough, so the only change that we're making is earlier action. But the rest of the order is based on the state order. The state order, we have a number of questions and a number of details, and we're in the process of getting clarification and working those out, and that may take a couple of days. But know that big picture, our Bay Area region is aligning with the state framework, and the only thing that we're changing is the timing.
And I can add that, I have a 10-year-old, and closing playgrounds is not a popular decision in my house. But I also, it's not only the activity itself. I think one of the principles that the state is applying here, and again, as Dr. Cody mentioned, we are trying to adhere to what the state has indicated, and that was the state's indication that playgrounds would be closed. It's not just that particular activity, it's what goes along with that activity. So it's the families that might gather if playgrounds are open, and other things that might actually increase transmission outside of that particular setting.
So Catherine Ho from the San Francisco Chronicle has a question that I think is a really valid one. And what I would like to do with this one is just go around the table and have each one of you address. Can you specify what time on Sunday each of the counties in Berkeley will enact the order, and then the times that Alameda and Marin will enact? So maybe we can start with Santa Clara and go around the room and just talk about what time the order takes effect in your county.
Sure. Thank you for the question. The order here will go into effect Sunday evening. And again, the thinking is to align with the framework set by the state and to give 48 hours. I also just want to say this decision, like all of these decisions, they're enormously difficult, and they are painful to make, which is why it's helpful for us to make them together. And we're trying to balance the trade-off of acting quickly to save lives. But also, we do understand that this is we are asking our businesses to do something that is rather heroic, and they need a bit of time to put things in place, and so that's why we are announcing today, but it becomes effective Sunday evening.
Dr. Willis, when does it become effective in Marin County?
Tuesday.
Any particular time on Tuesday?
Noon on Tuesday.
Great, thank you. Dr. Hernandez, what about in Berkeley?
So City of Berkeley always aligns with Alameda County because we are a city jurisdiction within a county. So not only do we share community, we share lots of other factors. So we are aligning with Alameda County, and our order will become effective Monday morning at 12:01 a.m.
Dr. Moss, anything that you'd like to add to that?
I can confirm that. Same for Alameda County, 12:01 a.m. Monday.
Great. Dr. Farnetano, Contra Costa County?
Our order will go into effect Sunday evening, but given the statewide curfew or nighttime stay-at-home order, effectively, Sunday evening, Monday morning, we're kind of aligned with our neighbors Santa Clara and Alameda and Berkeley on that.
And Dr. Aragon, San Francisco.
12:01 a.m. Monday.
Great. That was very helpful. Thank you. One more question from Angelina Wong. Is outdoor dining allowed during the stay-at-home order? Who would like to talk about that one? Dr. Farnetano, do you want to jump in on that one?
Sure. So with these new local orders, outdoor dining has to close, and restaurants can convert to a takeout or delivery model. And that's because any kind of activity that involves taking off your mask to eat or drink. Even though outdoors is safer, even outdoors poses a risk for COVID spread. And with the high risk of transmission in our communities, outdoor dining is more risky than it was 2 months ago.
All right. This is the last question I have. So if there are any other questions, I see Ethan has put his hand back up, so never mind about that. Kyle Bonagura would like to know, how does this order impact professional and college sports teams' ability to practice and host games? This is mainly for Cal and Berkeley and the Warriors in San Francisco. So why don't we start with Berkeley, Dr. Hernandez?
Sure. Thank you for the question. We are aligning, as Dr. Cody mentioned, we're aligning completely with the state in terms of the shelter-in-place order, and we will allow Cal to play their sports. They have a detailed return-to-play plan that I have reviewed and provided feedback, and they've have been using that plan for several months. And in addition to having that plan, which includes continual testing of the players and support staff, I meet weekly with the University of California, Berkeley leadership, and also more frequently as needed. So I'm confident in their program and the measures that they have instituted for protecting their players, the campus community, and the community at large.
And Dr. Aragon.
Yes, so in San Francisco, we are aligning with the state. In addition to aligning with the state, we require teams, both professional and collegiate sports, to have an approved plan before they can practice or play.
Great. Ethan, I'm going to unmute you if you'll ask your question.
Thank you. Yeah, it's Ethan Barron from the Mercury News. I'm wondering from the other counties, whether the other counties are aligning with Santa Clara County's the stricter rules that were announced Saturday with the on quarantine, the capacity limits for indoor facilities, and outdoor gathering restrictions. Is that something, and closing card rooms, and there were all the other ones with the post travel quarantine and essential travel restriction for hotels and other lodgings?
I can take that one. We're in taking these actions, we're really trying to mirror the new state regional health order as much as possible. So some jurisdictions do have already in place some stricter requirements in certain instances, but for applying these new changes, we'll really try to mirror the state regional order as much as possible. That does include closing outdoor card rooms. It does include limiting hotel travel to essential travel and the need for quarantine and isolation. So we are trying to stick as closely as possible to this new state regional health order.
I want to add something for Santa Clara County. We also, we've all stated, as much as possible, we want to align. I think it's far easier for our public to understand since we're so interconnected. And in that spirit, in Santa Clara County, we've made the decision to adopt, with regards to retail, we've made the decision to adopt the state framework of a 20% capacity across all sectors for just the reasons that Dr. Farnatano mentioned.
This is Nicholas Moss in Alameda County. We similarly are really going to follow the state's restrictions, which address many of those areas brought up in the question. And I think that's because we feel like these are actually fairly sensible and appropriate in terms of next steps to try to get things under control. And again, so the main difference is really introducing them earlier, but sticking with the limits and the specific areas laid out in the state order.
Great. We'll go back to Raquel Dillon at KQED. What do these orders mean for hotels and rental services? Who would like to take that one? Maybe we can pick on Dr. Farnetano again.
Sure. Yes. So hotels and other kind of short-term rentals need to limit their occupancy to people who are traveling for essential travel and those who are needing a place to stay because of isolation or quarantine. So that really mimics the language in the state regional order once again.
Great. One more question from Tayana Garcia, Univision 14. Will there be fines, infractions given to anyone who doesn't follow these guidelines, and what will the consequences be if they don't? I assume there'll be somewhat different answers for each question. Who would like to start?
I can start. Our approach in Alameda County has been first and foremost an education approach, working with communities, businesses, various partners out there to focus on changing things, to come into alignment with restrictions, because really it's in the best interest of our communities. And that has been successful so far. Certainly there's individual cities within our counties also have a role to play in how we approach all of these types of efforts, but generally that has been the approach across Alameda County, and that's what we are looking to first with these new restrictions.
And I'd like to add, as a city within Alameda County, in mid-September, the Berkeley City Council did amend our municipal code to include an ability to impose violations with fines for individuals that violate physical distancing or face covering orders. And we've been working with the community. First, as Dr. Moss mentioned, our approach always is to provide education and support to the community to be able to successfully comply with our requirements and our restrictions. That we know is the most important way to get individuals to be safe. So we've started that in September. We have not issued any citations. We have worked with businesses to improve some of their compliance, but no infractions have been issued at this point.
Thank you.
And I would just say,
Go ahead, Matt.
I'll just say, echo from Marin. Similarly, we're not anticipating sort of a categorically different way of enforcing this particular order, continuing with the way we've been approaching the orders historically. Cities and towns, I mean, this is law, so violating the order is breaking the law. And so local cities and towns and local law enforcement have been excellent partners in this. We also, like Berkeley, have offered a process by which citations can be offered. But, we've also learned, and it's obvious that when you have an order like this that applies to every single person in every single sector, enforceability is really challenging. And at the end of the day, we really do rely on people's individual behavior and individual choices in what is ultimately voluntary compliance. We get 95% of the benefit from people understanding through education and just really understanding the value of community well-being and health, and how we to support one another is far more important culturally than what we can accomplish through the enforcement arm, although we're gratified that we have good partnerships with law enforcement and others to enforce these regulations.
And in Contra Costa County, it's very similar. We also, our Board of Supervisors had passed a municipal fine ordinance, but we really do approach things and local law enforcement and local city code enforcers really do approach it from an educational point of view. And we've been very fortunate that most of the community has been very willing to follow the health directives, and the ones who aren't usually respond to an educational approach. And it's been very rare that we've had to go beyond that. We have had to issue fines. There have been fines issued in our county for at least one indoor bar and a couple of indoor gyms that were operating against the orders, and both putting their employees and their customers at risk. And so it's important that it's really trying to protect the health of the community that these rules are in place, and it's also fair to the people who are trying to follow the rules, that the ones who aren't are asked to follow the same rules.
Anybody else want to add anything to that question? We only have one question left. And that is a further clarification about the time that orders are effective in Santa Clara and Contra Costa counties. So Dr. Farnatano, am I correct in saying that ours starts at 10 p.m.
Yeah,
on Sunday? Yeah.
10 p.m.
And Dr. Cody, is that the same for Santa Clara?
I believe yes. I would like to. Everything has moved very quickly. I'm getting the yes, yes for 10 o'clock, and that's because the stay-at-home order for counties in the purple tier starts at 10 p.m. And so after 10, that is already in place.
Great. It looks like, yes, it looks like Ethan from the Mercury News has one more question. So Ethan, we'll call on you.
Thank you. So, Dr. Cody, I just have a question for you. Given the steps that the other health officers have not announced here, would you reconsider the steps you've taken in Santa Clara County with regard to the 49ers, and also with Stanford and Santa Clara and San Jose State, with contact sports?
Yeah, in Santa Clara County, as you know, we took action that we announced last weekend because of the position that we're in our surge in cases. And so some of our restrictions, including contact sports, are stricter than in other places. And we've aligned our frame, sort of a through line from youth to collegiate to professional sports. And that will remain in place, as will our travel and quarantine restrictions. But the area where I think it will be quite difficult for businesses without alignment is with the retail. So we will be adopting the state framework of 20%, and that runs through whether it's considered a quote essential business like grocery and pharmacy, or whether it's other retail. It's 20% across the board. So that will change.
Great. That is all of our questions. I really want to thank all of our panelists today for being here. I'll reiterate again, this is a tough decision to make, particularly at this time of the year. And so we appreciate you taking the time to be here today to talk about this important thing, and wish you all happy holidays. So thank you for joining us.
Thank you.
Thank you.